Well, we have heard what the Catholic Church has to say. Let's now find out what's on the government side of things. We go to our city centre studio now, where we're joined by Dr. Nicholas Muraguri. He is the Director of Medical Services. Thank you for joining us this evening. Now, at the heart of this matter is this allegation that this vaccine actually causes sterility. It produces an antigen that causes sterility in women. Is there any truth to that claim?
I would like to really clarify that the current vaccine we are using is very safe, and it's the same vaccine that is used even when somebody is injured. So it's not a new vaccine we are introducing, the normal routine vaccine against tetanus that is provided in hospitals when somebody is injured. These allegations are therefore very false and very unfortunate, because the information we have so far is that even the lab that has been claimed to have tested the particular vaccine is actually claiming that there's nothing like that. They have not even tested any vaccine in their labs. And it's rather very unfortunate. So I'd like to reassure everybody that the vaccines available in Kenya are procured globally through international reputed organizations like United Nations, and they usually buy vaccines for the whole Africa. And we have very stringent quality assurance system all the way from manufacturing, transportation, and even distribution. So I want to make it very, very clear to everybody that the vaccine is very safe and is no different from the vaccine we routinely use in health facilities.
Right. So you're saying that this is 100% safe. Does that mean that the Catholic Church is lying when they say they've carried out a test and had those findings?
I think it's full of contradiction, because they have not submitted any report. The lab that they purported to have tested the vaccine has actually confirmed to me that no such a thing ever happened, and it's rather unfortunate. We appreciate what the Catholic Church is doing. They are key partners, and we work together in saving the lives of mothers and children, providing healthcare in Kenya. This particular campaign of eliminating the neonatal tetanus is a global campaign, so it's not only Kenya doing this campaign. It's one of the global agendas ensuring that we ensure survival of children and eliminate some of these preventable illnesses like neonatal tetanus.
Then let's talk about, sorry to cut you short, but let's talk about the fact that you're targeting women between the ages of 15 and 49. As Dr. Karanja raised earlier, why are you targeting this particular group? The Catholic doctors say that they have not really seen many cases of neonatal transference of this infection. So why would you focus on this and on this particular group, not men, not other age groups? Why the women aged 15 to 49?
So first of all, the facts we have in this country is that we have a child dying every day from neonatal tetanus. These are conditions that is preventable. So as we are going towards eliminating neonatal deaths and the children deaths, these are critical steps towards ensuring that we meet that goal. Why 15 to 49? These are age group of women of reproductive age is the right target to target, because soon they become mothers. And one way we try to ensure that as they grow up, as become mothers, they are fully immunized against this particular condition, and they're able to transfer the same immunity to their children. We are excluding boys because we know the boys don't give birth, and that's why we are particularly targeting women between 15 and 49 years. Those are women of reproductive age.
All right, let's quickly talk about the Ebola situation that is, of course, going round, with the death toll hitting 4,400 across the world. How prepared is Kenya?
Kenya, we have a very elaborate contingency plan that has a number of components. For example, we have labs that are able to diagnose Ebola. We have been scaling up our training programs both within national government and also county governments. We are rolling out a public awareness campaign, and also we have very stringent surveillance systems in our port of entry, in the airports, and also any land of port of entry in the border points. We are also been working very closely with other arms of government to ensure that we are well coordinated in our response. So, and at the same time, we are also identifying isolation facilities in various points of entry into the country. Collectively, we are getting ready and better every time. And we have tested our systems. There have been a number of scares, and lucky enough, so far we don't have any case of Ebola on Barbag or any hemorrhagic fevers. So Kenya is one of the countries that is most prepared to respond to these threats.
most prepared. Well, a lot of people do feel that luck is a huge factor here. Yesterday we did a story where at the border points there was literally no screening and no control. On a scale of 1 to 10, how prepared would you say Kenya is?
So I could say, given the current level of threats, I can give it an 8 out of 10, because the key pillars that are required to ensure that we respond appropriately are there. That is diagnosis, training of health workers to respond, surveillance, and also contact tracing and communication. So these are the major pillars of any response, and we have been working collectively, and every day we are increasing the number of health workers who we are training. In fact, Kenya will soon send health workers to West Africa to help them respond to the threat there. So Kenya is well prepared, and we are getting ready and expanding the workforce that we have to be able to respond to this threat.
All right. Well, 8 of 10, that's a pretty high score. Well, thank you very much for joining us this evening, Dr. Muraguri.